So for my injury, I picked a herniated disc in the cervical spine, and it is compressing a nerve. For the athlete, they are a football athlete, and the MOI was neck flexion into 30 degrees with axial loading. They come into the clinic day one, acute injury, and they're complaining of neck pain, also burning pain in the shoulders, neck, and arm. Okay, so history, I'd ask questions along the line of when did this happen, how did this happen on a scale of 1 to 10, can you rate your pain, being 10 going to the hospital, can you point to the pain, when do you feel pain, so like pain during specific movements, when does the pain go away, have you had any previous neck injuries, did you feel any unusual sounds or sensations, for answers at the very ends of all of this, I'd probably suspect like numbness, tingling, basically nerve pain to be present along the shoulder, neck, and arm area. Okay, so for the observation portion, I would look at the athlete's posture, if they have any hesitated movements during range of motion when I go through that, if there's any discoloration or spasms present. So when going through range of motion, I would test for cervical flexion, extension, lateral flexion, and lateral rotation. Active first and then passive. Then you could do strength testing with those 4 movements. Then I would test dermatomes and myotomes, since they did mention that they were experiencing nerve pain when I was doing the history portion earlier. And then I would test reflexes, and at the end of it, I would find that there is weakness present when testing one of the myotomes. Okay, for special tests, the first one is the Valsalva maneuver. This one, it's going to be positive if there's radiating symptoms down involved nerve root, and it's used to assess cervical root compression. Okay. Okay, for the second special test, I wrote compression test / Sperling test. So this one, you do it like this, and you push down, make axial load. And it's positive when symptoms are present down the side of the nerve root compression. And then you can do the Sperling test to, you gotta move your head this way, determine which side the compressed nerve root is. Third special test is shoulder abduction test. This one is positive if pain and symptoms are reduced during the test, and it's used to assess cervical root compression. And when they're doing it, make sure the elbow stays back so she's doing it good. Okay, for the fourth and final test, I chose cervical compression relief test. And this one I like to do with their head kind of off the edge of the table. And then you just pull backwards, and it's a positive if the signs and symptoms are relieved, and it's used to assess cervical root compression. So management, the doctor will have to prescribe a short period of rest. They need to use a neck collar to immobilize the cervical spine. Also, NSAIDs can be used to reduce swelling, and physical therapy is going to be prescribed. At the end of the week, if signs and symptoms don't go away, then they're going to have to look into surgical treatment options.